I think we need to see at least two or three different things coming from the vaccines. Of course, we need to prevent death and severe illness, but we also need to be able to prevent people from getting infected in the first place or transmitting the virus onto others. And so far, we don't actually have adequate data in that regard. On top of all that, of course, we need vaccines to actually reach people, to get into people's arms, into their bodies. And as you were just saying, we're having major challenges with this, certainly here in Europe, but of course, the situation is even more dire when we look outside of the wealthiest countries, where many, many countries either have no vaccines at all or don't expect to get very many throughout the rest of 2021.
And on that note, because I know you've done a lot of work looking at the vaccine picture for the developing world, this interesting dynamic is playing out here between China and India, vaccine diplomacy, if you will. We're seeing now India determined to use its vaccine manufacturing capacity to extend vaccines and extend support to neighboring countries. At the same time, we've seen China try to extend its reach and improve bilateral relations by offering its vaccine to countries outside of China. What do you think of what we're seeing here? Is this encouraging from a global health perspective to see these two big powers in the emerging world try to use their vaccine capacity for good?
Yeah, I think that these countries are definitely playing a much more important role in global supply, particularly for other developing countries, than we've seen in past pandemics. And on the plus side, if these vaccines are proven to be safe and effective, they can definitely supplement or even be the main source of supply for countries who are not able to get vaccines, for example, from the big Western multinationals. I think we also have to remember, though, that we have seen every single country scrambling to get access to vaccines. Every country considers a vaccine right now to be a strategic asset that will allow their economies and societies to get moving again. And countries that have tried to use vaccines as a tool of diplomacy, I think, have found that this is, in fact, it's a really effective tool, right? So we've seen that India, for example, recently shipped exported vaccines to a number of neighboring countries with whom they want to strengthen their alliances. And these countries are very happy to in fact, get vaccines at the same time as Indian citizens. China, I think, from the get-go has been playing a very sophisticated game. From already middle of last year, they were striking deals to do clinical trials in Southeast Asia and Latin America to transfer technology to make a number of their vaccines available to countries that, again, might not get those vaccines from Moderna, Pfizer, AstraZeneca. Some of the companies that we're relying on in Europe. This does raise a big question for the US and Europe as to whether they would also like to make more efforts to ensure that the rest of the world gets access to vaccines in order to not sort of lose in this diplomatic race, so to speak.
Suerie, that actually brings me on to my next question. In the context of vaccine diplomacy, you bring up EU and US. I've seen some calls from human rights groups, actually, saying that they should water down some of the provisions that provide the vaccine manufacturers with intellectual property protections. Do you think that that would be a good step to help facilitate the scale production of vaccines, especially in some of the lower and middle income countries where clearly there's a huge demand but not enough supply going in that direction right now?
Yes, indeed. Everybody is scrambling for a piece of the pie, and the pie is simply not big enough to meet global demand. That's very clear, and I think there's been a wake-up call here in Europe about that, of course, over the last few days. What we've seen is that intellectual property plays a very different role for vaccines in this pandemic than it might in other, let's say, more normal markets. And what I mean is that governments have de-risked and subsidized the vaccine R&D process all the way from the beginning, the earliest stages of R&D, through the scale-up of manufacturing, and now with the purchase of products at the end of the process. And so companies are not taking on the same kind of risks that they would in a normal commercial market. And so the role of intellectual property in incentivizing that risk-taking and investment behavior is really much, much smaller than it would be in, let's say, normal times. And for this reason, I think some of the consequences of lifting some of these monopoly protections is going to be much smaller than some alarmists have claimed. It makes a lot of sense, in fact, to try to make that pie as big as possible and to share the recipe, so to speak. What many developing countries are really looking for right now is the ability to scale up their own manufacturing, and for that, they don't need the ingredients. What they need is the recipe, and the recipe is protected right now through intellectual property.